First of all, good morning, good afternoon, good evening, whatever time of the day you're in, I hope you're doing well. So, for today's discussion, we will be talking about the treatment of schizophrenia. So, stay tuned in and enjoy the rest of the discussion. See you. The search for help has taken many paths, sometimes down some disturbing roads. For example, in the 1500s, primitive surgery was conducted to remove the stone of madness, they call it, which was thought to cause disturbed behavior. As barbaric as this practice may seem today, it is not different from the prefrontal lobotomies performed on people with schizophrenia as late as the 1950s. This procedure severed the frontal lobes from the lower portion of the brain, which sometimes calmed the patient, but also caused cognitive and emotional deficits. So even today, some societies use crude surgical procedures to eliminate the symptoms of schizophrenia. In the Western world today, treatment usually begins with one of the neuroleptic drugs invaluable in reducing the symptoms of schizophrenia for many people. They are typically used with a variety of psychosocial treatments to reduce relapse, compensate for skilled deficits, and improve cooperation for taking the medications. So, diba, in 1500s, usually they have this procedure na to cut the frontal lobe, to take note sa lower part sa brain. So, sahay is effective in making patients na makalma sila, pero nadya po na yung downside, which makakause of cognitive and emotional deficits, or what we call mental and emotional deterioration. Let's move on. Biological interventions. So researchers have assumed for more than 100 years that schizophrenia requires some form of biological intervention. Kraepelin, who so eloquently described dementia precox in the late 19th century, saw the disorder as a brain disease. Lacking of biological treatment, he routinely recommended that the physician use good patience, kindly disposition, and also self-control to calm the excited patient. So this approach was seen as only a temporary way of helping the person through disturbing times and was not thought to be an actual. Next, we have antipsychotic medications. A breakthrough in the treatment of schizophrenia came during the 1950s with the introduction of several drugs that relieve symptoms in many people. So, it is called neuroleptics, meaning taking hold of the nerves. These medications provided the first real hope that help was available for people with schizophrenia. When they are effective, neuroleptics help people think more clearly and reduce hallucinations and delusions. They work by affecting the positive symptoms such as delusions, hallucinations, and agitation, and to a lesser extent, the negative and disorganized ones such as social deficits. So, antipsychotic medication still. Initially, it was thought that the newer drugs had fewer serious side effects than the conventional antipsychotics. However, two large-scale studies, one conducted in the United States called the Clinical Antipsychotic Trials of Intervention Effectiveness, or CATI, and one in the United Kingdom called the Cost Utility of the Latest Antipsychotic Drugs in Schizophrenia Study, or CATLAS, found that the second-generation drugs were no more effective or better tolerated than the older drugs. These results point out how important it is to carefully study the outcomes of all new treatments. So, in antipsychotic medications, the gist of it really is a leap forward in the treatment of schizophrenia came during 1950s with the several drugs naman that were introduced that actually relieve symptoms experienced by many people. So, ginatawag og neuroleptics, meaning of course na siya, taking hold of the nerves, also known as tawag na itong antipsychotic medications. Muna sila gagamit to use in order to manage symptoms of many psychiatric disorders. So, ang mga medication gave hope and help for the people with schizophrenia. Signs that the antipsychotic medication was effective is that people starts to think more clearly. So, ilang panahon is very clear, and there is no progression, or there is a reduced hallucinations and delusions. Now, each or some drugs is effective and works for some people and not for others, diba? Both the clinicians and patients have to go through trial and error process in order to find what medications works best So the earliest neuroleptic drugs was called conventional. Katong pinaka earliest na discover nga drugs is what we call conventional or first generation antipsychotism, such as Haldol and Thorazine. It works for mostly 60 to 70% people who have tried them. So if natin yung mga people who are responding well to the first drugs, okay, sila sa first drugs in the first generation that were discovered, some people naman responds well to the new medications, or sometimes we called atypical or second generation antipsychotics. So masay the most common are risperidone and olanzapine. So kaning mga drugs na ginagamit usually to patients na wala na tablan or were ineffective in the previous medications. Okay. So next, we have the non-compliance with medication and why. So initially, it was thought that the newer drugs had fewer serious side effects than the conventional antipsychotics. However, two large-scale studies, one conducted in the United States, what we call the Clinical Antipsychotic Trials of Intervention Effectiveness, or CATI, and in one in the United Kingdom, also called Cost Utility of the Latest Antipsychotic Drugs in Schizophrenia Study, or CATLAS, found that the second-generation drugs were no more effective or better tolerated than the older drugs. These results point out how important it is to carefully study the outcomes of all new treatments. So, in terms of the effectiveness of antipsychotics, they work only when they are taken properly, or in my terms, important to take it religiously. Take for example the case of David, na ang tambal na supposed to be harmful sa pag-reduce sa iyang hallucinations, instead of taking it the opposite action he did was to spit it out after placing it in his mouth for a minute, and after that, when no one else was looking at him, he spit it out. So for those people na na schizophrenia, I would feel, I feel well throughout the process of my medication, so they don't feel like wanting to continue the medication na kasi nga they feel well. So case ni David is after 18 months after use, of course you feel very well because it indicates that the medicine you are taking is working and therapeutic on your part. So kanang tambal na ginatake sa schizophrenic or not, basta as long as it falls na kay mental illness, it would have a side effect on your part. For example lang, blurred vision, dryness of mouth. So these symptoms include lack of muscle control with people who has Parkinson's disease. And another area, we call it akinesia, is a common feeling frozen and stiff, and you are unable to move your muscles. So another example would be extrapyramidal symptom, which is a side effect, is tardive dyskinesia, which involves involuntary movement of the tongue, face, mouth, or jaw. Okay. So now, let us proceed to additional biological treatments. This is an interesting treatment for the hallucinations experienced by many people with schizophrenia. Involves exposing the individual to magnetic fields called transcranial magnetic stimulation. This technique uses wire coils to repeatedly generate magnetic fields up to 50 times per second that pass through the skull to the brain. This input seems to interrupt temporarily the normal communication to the part of the brain. They found that many of the individuals who has auditory hallucinations experience improvement following transcranial magnetic stimulation. Preliminary research has shown that though this intervention may modestly improve auditory hallucinations, its effects last less than a month. So, in additional biological treatment, one treatment for hallucination involves exposing the individual to magnetic field called transcranial magnetic stimulation. Use wire coils to generate magnetic, okay, it's being said. So this technique ginagamit to stimulate the area of the brain that involves hallucinations, for those, of course, who experience auditory or what we hear hallucinations. So, okay, let's continue. Next, we have psychosocial interventions. So today, few believe that psychological factors cause people to have schizophrenia, or that traditional psychotherapeutic approaches will cure them. Nevertheless, you will see that psychological methods have an important role. Despite the great promise of drug treatment, the problems with ineffectiveness, inconsistent use, and relapse suggest that by themselves, drugs may not be effective with many people. Until relatively recently, most people with severe and chronic cases of schizophrenia were treated in hospital settings, borrowing from the behavioral approaches used by Ted Eilon and Nate Azurin, Paul and Lenz, designed an environment for inpatients that encourage appropriate socialization, participation in group sessions, and self-care such as bed making while discouraging violent outbursts. So So next, in contrast to traditional therapy, behavioral family therapy resembles classroom education. Family members are informed about schizophrenia and its treatment, relieved of the myth that it caused the disorder, and taught practical facts about antipsychotic medication and their side effects. They are also helped with communication skills so that they can become more empathetic listeners, this is true. And they learn constructive ways of expressing negative feelings to replace the harsh criticism that characterizes some family interaction. Psychosocial intervention. So sa una pa dianing panahon, nga number of psychosocial treatment is tested and tried for those who have schizophrenia. So yes, effective lagi if you take these drugs. Pero few of the factors nga makabungkag sa imong healing along the way, which is dili siya effective, dalag sa rakamotik sa tambal, imong escape, sumubalik na pod. Tas uno. So, in the 19th century, patients' care involved moral treatment, emphasizing socialization, mga routines, for self-control, ang imong value sa work, sa mga para nimo ang religion, cause most of the time, people who are schizophrenic lose a sense of self, taking care of themselves, even ilang hygiene. So, ilan na nang nakalimutan. Okay? So, nasa lagi natawag nga token economy. For example, timpyo kayo mong katre. So, as a token, that person can buy cigarettes using the token he earned for keeping his room clean. So, as you can see here, we have table 13.3, which talks about independent living skills program at UCLA. So, we have the module, symptom management, and we have the skill areas. We have identifying warning signs of relapse, and then we learn to identify personal warning signs, to monitor personal warning signs with assistance from others. Next, we have managing warning signs. Yes, indeed, to obtain assistance from healthcare providers in differentiating personal warning signs from persistent symptoms, medication side effects, and variations in mood, to develop an emergency plan for responding to warning signs. And the next, we have coping with persistent symptoms, which is to recognize and monitor persistent personal symptoms to obtain assistance from healthcare providers in differentiating persistent symptoms from warning signs, medication side effects, and variations in mood, to use specific techniques for coping with persistent symptoms and to monitor persistent symptoms daily. We have avoiding alcohol and street drugs. To identify adverse effects of alcohol and illicit drugs and benefits of avoiding them. To refuse offers of alcohol and street drugs. To know how to resist using this substance is in coping with anxiety, low self-esteem, or depression, to discuss openly with the use of alcohol and drugs with healthcare providers. And lastly, we have medication management. So we have here obtaining information on antipsychotic medication to understand how these drugs work, why maintenance drug therapy is used, and the benefits of taking medication. Next, knowing correct self-administration and evaluation. To follow the appropriate procedures for taking medication, to evaluate responses to medication daily, and then identifying the side effects of medication, which is to know the specific side effects that sometimes result from taking medication and what to do when these problems occur. And then lastly, negotiating medications issues with healthcare providers, to practice ways of obtaining assistance when problems occur with medication. Okay, so here in figure 13.9 shows the study on treatment of schizophrenia from year 1980 to 1992. Okay, so research suggests that illustrates that the studies reviewed by one group, which show the multi-level treatments reduce the number of relapses among people receiving drug therapy in comparison with simple social support or educational efforts. Okay. So next we proceed to treatment across cultures. So treatment of schizophrenia with its delivery differ from one country to another and across cultures within countries. The vast majority of the Xhosa people, South Africa, who have schizophrenia report using traditional healers who sometimes recommend the use of oral treatments to induce vomiting, enemas, and slaughter of cattle to appease the spirits. Okay, Latinos may be less likely than other groups to help seek in institutional settings, relying instead on family support, adapting treatments to make them culturally relevant in this case, adding important relatives to the social skills training of Latinos with schizophrenia is essential for effectiveness. As you can see in the picture, treatment for the symptoms of schizophrenia vary widely by culture, from humane approaches using empirical validated interventions to simply removing the person from the society. So, ang treatment of across cultures varies, right? So, treatment of schizos differ from one country to another. So, take for example, in Africa, those who have schizos, they go to faith healers. Another example is native Chinese hold more religious belief about both causes and the treatment of schizophrenia because it is believed by them that schizophrenia is done by evil. Okay, so now let us move on to the last part of this discussion. For the prevention, one strategy for preventing a disorder such as schizophrenia, which typically first shows itself in early adulthood, is to identify and treat children who are at risk for getting the disorder later in life. A classic at-risk study was initiated in the 1960s by Sarnoff, A. Mednick, and Finney Jolsinger. They identified 207 Danish children of mothers who had severe cases of schizophrenia and 104 controlled children born to mothers who had no history of the disorder. The average age of these children was about 15 when they were first identified, and the researchers followed them for 10 more years to determine whether any factors had predicted who would and who would not develop schizophrenia. We have already discussed pregnancy and delivery-related complications. Now, Mednick and Schlesinger also identified instability of early family rearing environment, which suggests that environmental influences may trigger the onset of schizophrenia. So, poor parenting may place additional strain on a vulnerable person who is already at risk. Now, one approach to prevention of schizophrenia receiving increased attention is the treatment of person in the prodromal stages of the disorder. Okay, talking about that, here is an individual is beginning to show early mild signs of schizophrenia, for example, hallucinations, delusions, but is aware of these changes. Efforts to intervene with these individuals are being investigated as a means of either stopping the progression of the disorder or preventing relapses. So, diba? It's stated in there, the stage. The individuals show early mild signs of schizophrenia such as hallucinations. So, all I can leave you before I end is the best prevention. There are ways naman, but the ways to prevent or reduce the symptoms of schizophrenia is that you have to take your medicine religiously and you have to avoid taking substance use, mga alcohols, and also coffee, caffeine. Yes, you have that kay makatrigger mo po na siya. And also, receiving or having a therapy, mas may po nang nakaka-history, di ba? So that you will improve and you will develop later on naman din, and start to live a new life in the perspective of healing, and eventually fully healed na ta tanan. Okay, so thank you so much for listening.